Understand your fundamental protections and entitlements with this comprehensive guide to the Resident Bill of Rights. This course offers an in-depth understanding of the Resident Bill of Rights, emphasizing how CNAs and healthcare workers can uphold these rights to ensure ethical, dignified, and patient-centered care in healthcare and long-term care settings. The Resident Bill of Rights is a fundamental framework that guarantees the dignity, respect, and autonomy of residents in healthcare facilities. It outlines the legal and ethical obligations healthcare providers must follow to protect residents' personal freedoms and ensure quality care. This course explores the core components of the Resident Bill of Rights and provides practical guidance on how to implement and uphold these rights in daily caregiving. Introduction to the Resident Bill of Rights. A Resident Bill of Rights establishes the basic rights and freedoms every resident is entitled to in healthcare facilities, especially in long-term care. It ensures residents receive care that respects their individuality and protects them from harm. Key points. Overview of resident rights and protections. Importance of promoting a respectful and dignified care environment. The role of healthcare workers in safeguarding these rights. Legal and ethical foundations of resident rights. Resident rights are grounded in federal and state laws as well as ethical principles governing healthcare. Legal foundations. Federal laws such as the Nursing Home Reform Act. State-specific regulations and facility policies. Ethical principles. Respect for autonomy. Beneficence and non-maleficence, justice and fairness in care delivery. Understanding these foundations ensures caregivers provide care that is legally compliant and ethically sound. Key rights included in the Resident Bill of Rights. A Resident Bill of Rights typically includes rights such as right to dignity and respect, treated as an individual with respect and without discrimination, right to privacy, confidentiality of personal and medical information, right to freedom from abuse and neglect, protection from physical, emotional, and financial abuse, right to participate in care, involvement in planning and decision-making, right to make personal choices, freedom to choose daily activities, visitors, and schedules, right to voice grievances, ability to express concerns without fear of retaliation, right to quality of life, access to social, recreational, and cultural activities. Respecting privacy, dignity, and confidentiality. Respecting a resident's privacy and dignity is fundamental to upholding their rights. Practices to ensure privacy and dignity. Providing privacy during personal care and medical treatments. Keeping medical records and personal information confidential. Avoiding unnecessary exposure during bathing, dressing, or medical procedures. Using respectful language and mannerisms. Rights related to care, treatment, and informed consent. Residents have the right to receive proper medical care and treatment. Be informed about their condition and care options. Consent to or refuse treatment after being fully informed. Receive care that respects their cultural, religious, and personal beliefs. CNAs support these rights by providing information, respecting decisions, and reporting concerns promptly. Resident rights in decision-making and participation. Active participation empowers residents and enhances care satisfaction. Supporting participation. Encouraging residents to express preferences and make choices. Involving residents in care planning and daily routines. Respecting decisions about lifestyle, diet, activities, and healthcare. Preventing abuse, neglect, and exploitation. Protecting residents from harm is a critical aspect of respecting their rights. Recognizing abuse and neglect. Physical signs, bruises, burns, injuries. Emotional signs, withdrawal, fear, anxiety. Financial exploitation indicators. Responding to abuse. Reporting suspicions immediately to supervisors. Following facility protocols for investigation. Providing supportive care to victims. CNA responsibilities in upholding the Resident Bill of Rights. CNAs are frontline advocates for resident rights. Key responsibilities. Treat residents with respect and dignity. Protect privacy and confidentiality. Encourage resident independence and decision-making. Report any violations or concerns promptly. Participate in ongoing training on resident rights. Conclusion and recap. This course has equipped you with a thorough understanding of the Resident Bill of Rights and how to uphold these rights in healthcare settings. As a CNA, your role is vital in ensuring residents receive respectful, dignified, and person-centered care.